Trust. As you know, it's part of the Shaping a Healthy Future programme for North West London, and the A&E body emergency in Hammersmith is planned to close on the 10th of September, and in preparation for that, an urgent care centre open 24 hours a day starting on the 23rd of June. It coincides with the changes taking place at Central Middlesex, and that's a decision taken by the Shaping a Healthy Future programme, because obviously if you were to close one for a short time before the other you will end up potentially with real problems in terms of patient flows. We've had a number of clinicians involved across the whole range of issues, both in terms of making sure that Hammersmith is prepared, largely because we also want to make sure that specialist services on the Hammersmith campus are readily accessible to the patients who need them, and that there is no increased problem with the patient pathway. So we've had a large group of clinicians working on clinical pathways and pretty much every other aspect of the Hammersmith, similar groups of clinicians in terms of Charing Cross and St Mary's, because obviously there'll be a knock-on. That's been overseen by a committee that's been meeting fortnightly, which has involved a number of the key clinicians and the number of executive directors, including the medical director, the chief operating officer, the director of commerce, who have been overseeing what's been going on. In terms of the Hammersmith, as I said, the UCC is up and running on a 24-hour basis now, and GPs are almost completely trained to the London Health Programme standards, and the unit will be running to those by the beginning of September. They will be running in shadow form from the beginning of August, so that there will be a period where they will act as if they didn't have direct access to the EU, so that we can test the system. Because we want to ensure that we use the specialists available at the Hammersmith, we have developed a hub for medical referrals from GPs. So GPs who want to refer to the medics at Imperial College Healthcare will phone a senior nurse who is supported by a medical registrar on call, who will be able to direct the patient to the most appropriate of our 3 campuses, including the Hammersmith, to deal with their particular medical problems, and also related to their past history, so they've got a history at any one of the particular sites, and also their geographical location. We've also thought about specific groups of very specialist patients at the Hammersmith who use our specialist units there, specifically the renal unit, the haematology and oncology patients, and obviously the heart attack centre will continue to run as it does. And for those specialist groups of patients, they will have direct access to the Hammersmith via a special number. There will be a specialist medical assessment unit at the Hammersmith to review these patients and to make sure that they are appropriately dealt with, and that will open on the 11th of August. And there will be a full general and acute medical on-call team at the Hammersmith Hospital to make sure there is appropriate medical cover to manage these patients. We've identified additional capacity to improve our discharge facilities, and we are also managing, improving our ability to manage more complex and sick patients on the Hammersmith campus within our acute and specialist medical pathways. We have had all the pathways now signed off and reviewed by all the clinicians involved in the clinical services at the Hammersmith. So we feel reasonably confident that patients who use our specialist services will have direct access to those services. Patients who it's appropriate to be an inpatient at Hammersmith because they've had previous inpatient and outpatient episodes there, or because they are local, will be able to have access to the facilities. Obviously, in closing the EU, there is a potential knock-on effect on the other sites within the Trust. St Mary's, obviously, is already a busy emergency department. We are planning a new ambulatory care unit which will be opened by the beginning of September. A lot of patients can be dealt with very effectively in an ambulatory approach. In other words, they can be seen, assessed by a specialist, and an appropriate plan put in place without necessarily having to be admitted to an acute hospital bed. And we are revising our acute medical model to ensure there are more specialists available to come down to the front door of the hospital to see these patients and to assess them. The number of patients, if every admission to the Hammersmith Hospital went instead to St Mary's, and every medical admission went instead to St Mary's, that would average at 13 admissions a day. We're opening an additional, it's actually 15 beds as in the inpatient wards to cope with this. I suspect that actually some will go to other places, including the Charing Cross, but we're obviously planning to make sure we have enough capacity to deal with the additional admissions. We are reconfiguring our emergency department to optimise the resuscitation facilities and to increase our ability to manage very sick patients. There is a state work going on there to increase the number of cubicles for majors patients and also to increase our resus area. And all of our medical assessment unit pathways are being reviewed. Again, medical patients who want to be referred to the trust again come to that single point of access. So that will again enable us to manage our acute medical take. We're increasing the staffing at St Mary's to cope with the additional anticipated activity with 3 additional core medical trainees, what I used to call senior house officers.